The following is a presentation called Experts Speak on Chronic Pain. Contributing experts are the fictitious Dr. Charles Excalibur and Dr. Arya Snark, both with a PhD in psychology. As a brief overview, chronic pain is a potentially debilitating condition that can take a drastic toll at both the individual and organizational level. Medical treatments are some of the more commonly known treatments for chronic pain conditions, including medications. Medical treatments are not, however, the only treatments available. The American Psychological Association suggests the potential for psychological treatment in chronic pain management by stating, psychologists may collaborate with other healthcare professionals to address both the physical and emotional aspects of the patient's pain. The vast personal and organizational costs associated with chronic pain experience make this an important topic. Gaskin and Richard found economic losses alone related to chronic pain total between $560 and $635 billion in 2010, with losses higher than those for cancer, heart disease, and diabetes. The contributing experts are health and rehabilitation psychologists. Health psychologists examine how biological, social, and psychological factors influence the choices that we make about our health, and they have a focus on understanding attitudes about health and encouraging individuals to be proactive about their health. Rehabilitation psychologists have a goal of helping individuals with disabilities and chronic health conditions, like chronic pain, improve the quality of their lives. To begin, we'll start with our expert, Dr. Charles, who is a clinical health psychologist with a PhD in clinical health psychology. He typically receives patients on referral from the local hospital, pain treatment centers, assisted living facilities, and doctor's offices. He earned his degree at the University of Florida and was awarded a postdoctoral fellowship at FSU in Immokalee, Florida. Dr. Snark is a rehabilitation counselor who works in an assisted living facility and sees the current residents of the facility. She develops treatment regimens for the patients. She earned her degree at the University of Wisconsin-Madison and has a national board certification through the American Board of Rehabilitation Psychology. Dr. Charles' statement is as follows. Research is putting us on a track to understanding how people with chronic pain can be one of their own greatest resources, and how mindfulness in the patient mediates the pain that patient experiences and reports. For instance, we're starting to see that a patient's use of coping strategies can lead to better outcomes for that patient, in the form of reduced chance of disability and even depressive symptoms. A great example of this research was conducted by Shute and Wright, who found that a patient's mindfulness correlates with that patient's ability to manage their own pain. When we're being mindful, we're really paying attention to our condition. We're not just experiencing it, but we're considering it as well. Mindful patients just seem to manage their own pain experiences better, and they report less pain because of it. The U.S. Pain Foundation has a list of pain management interventions, including mindfulness, and provides links on its webpage to other resources providing useful information for mindfulness and relaxation techniques. Meanwhile, Dr. Snark stated, offering patients rehabilitation services is one of the most proactive moves we can make in health. Our job as rehabilitation psychologists is to work with individuals who have often experienced life-altering events. We want to help them improve their quality of life. Something that we're really interested in is how we can address a patient's perceptions as a part of pain management. It's no secret that a patient's perceptions can affect how well they deal with chronic pain. Alschuler, Eade, and Kratz, they've shown us that a patient's moods, thinking, emotions, beliefs, and acceptance help determine whether they are buffered against pain or whether they experience greater suffering. So we know that rehabilitation has to focus on those unseen cognitive aspects to truly help an individual and improve their quality of life. A great resource for chronic pain sufferers is the Cleveland Clinic's website, which talks about the Chronic Pain Rehabilitation Program and lists the many treatments provided by the clinic used to address the psychosocial needs of chronic pain sufferers, like cognitive behavioral therapy. The major points made by Dr. Charles include that the patient is one of their own greatest resources in pain management, that mindfulness is important to pain management, and that the patient's ability to cope is correlated with decreased risk of disability and depressive symptoms. Dr. Snark's main points include that rehabilitation services are an important part of proactive health care, that addressing patient perceptions is an important part of pain management, and that patients' thoughts, moods, beliefs, acceptance, and emotions can buffer against the pain experience or exacerbate it. The two overlap in the importance they place on addressing patient perceptions and pain management, and in that both fields require frequent collaboration with other health professionals.